Justin, we learned 5 common diseases that affect the reproductive system, and they are overweight and obesity. Studies show that women overweight before their pregnancy can cause complications during pregnancy. But if overweight before their pregnancies and can lose weight, they are likely to have a healthier pregnancy. Another common disease is diabetes. If you have high blood sugar during your pregnancy, you are harming the fetus and it can also worsen a woman's long-term disease. Depression is another common disease. During pregnancy, depression is hard for the mother to care for her unborn child. High blood pressure is a fourth one. It causes problems for the mother and the baby. It can also cause the baby to have a low birth weight and other difficulties during birth. HIV is the last one. It can be passed from the mother to the baby during pregnancy or during delivery. Thank you all, and that's all. Back to you, Emily.
Thank you, Dakota. Now here are a list of medications that affect the reproductive system. Methyldopa, a medication to help treat hypertension, can affect ovulation by a significant rise in the amount of prolactin in the body. Sulfasalazine, a medication that helps treat inflammatory disorders, can affect the reproductive system, risking fertility. Thyroid medications can affect ovulation if a smaller dose or larger dose is prescribed to you. In fact, many hormone-based skin and hair products can affect ovulation, but it is rare that it will affect it. It is very much recommended to stay away from them, but they may contain estrogen and progesterone that can be absorbed. In addition, overuse of illegal substances and alcohol can ruin male and female reproductive systems and lessen the chance of being able to have a baby. Now, Justin with Sierra with the latest news on the environment.
Thank you, Emily. Well, the weather for today is cloudy and an 80% chance of rain. Did you know that the environment can have effects on the reproductive system? Well, it does. The environment is full of toxic chemicals that can harm women and fetus during pregnancy. An example is smoking. Even though all the doctors tell you that if you smoke, it's more harmful to the baby, which is true. And you're more likely to get lung cancer. True as well. Although secondhand smoke is a major factor as well. It is. So keep your environment clean and do routinely checkups. Keep up the health. And now it's time for Abby with the Daily Facts.
And thanks, Sierra. A female body with too little fat will stop producing leptin, which is a hormone that triggers a woman's menstrual cycle. During this time, ovaries do not release eggs, therefore a woman is incapable of becoming pregnant and menstruation stops. And eating disorders have also been linked to higher rates of infertility. With the general population, only 22% know that smoking can affect fertility. According to the American Society for Reproductive Medicine, smoking cigarettes increases females' risk for the delay of conception, ovarian follicular depletion, and even chromosomal damage in eggs. Our bodies require careful nutrition to function at their best. When thinking about fertility, a proper diet is key. Your diet should include vitamin A, D, iron, and folic acid. Stress can affect our bodies, potentially interfering with the normal menstrual signaling. Practicing self-care can improve both mental and physical health. Some great self-care methods include moderate exercise, meditation, and a sufficient sleep. And also, an American Congress of Obstetricians and Gynecologists recommends that the young females first consult with their gynecologist between the age of 13 and 15 to discuss healthy habits, personal hygiene, and potential immunizations. At the age of 21, females should have their first pelvic exam to assess internal and external reproductive health. If experiencing pelvic pain or menstrual problems, contact your doctor immediately. And that concludes the Daily Facts for today. And here's an exclusive interview with an OBGYN professional.
All right, what's your childhood like?
Okay, well, I was born in the Philippines. My dad is in the Navy, so we kind of move around a lot. My childhood, I grew up with my mom and my grandparents, and they kind of raised me because my dad was in the military serving overseas. And so, I was like a little farm village boy. That's really where I grew up. I loved climbing trees, loved playing outside. That's what I just did. That's pretty much my childhood. And then when I was about 6 or 7, we moved to America, and I went to, I lived a lot, like the first 5 years here in Virginia Beach area. So that's kind of where I grew up, and that's why I always knew I would come back to Virginia. But then with military parents, we moved everywhere. So I went to a different high school. I moved to Tennessee for high school. Then I moved to Japan to finish out my high school. And actually, that's where I graduated high school from. My class in Japan was a class of 20.
Wow.
Yeah, the whole school had 500 kids, and that was from kindergarten to 12th grade.
Wow.
Yeah. It was crazy, but I loved it because, teenager, no real responsibilities besides high school, but living in a completely different country, exploring, fantastic. Then I went to William & Mary for college, and then medical school, and here I am.
Awesome. Do you have a story from your childhood that has stuck with you throughout the years?
Oh man, a bunch of those. I think one good story is probably like, I was about 10 or 11 years old, and like I said, we lived in Virginia Beach. Well, we went to Williamsburg for the first time, Busch Gardens, and we went to Busch Gardens, and then we drove around Williamsburg because it was, colonial. I've never seen that stuff. And we were driving by the school, and my dad's like, "You see that school right there? Only smart people go there." And he was pointing at William & Mary, and that really stuck with me. And so that was why I decided to go to William & Mary, because I was like, gotta go there. Smart people go there, so I'll go there.
What made you want to become an OBGYN?
It was like the first thing that I thought I would never do. I'm being honest with you. I always knew I wanted to be a doctor. Since I was little, I always wanted to be a doctor. So that wasn't the problem. But as you go through medical school, the first 2 years you do medical school, it's mostly like in the classroom, books, what you typically think of. And then the third year, you actually rotate at every single specialty. So family medicine, internal medicine, OBGYN, surgery, pediatrics. You rotate through every single one. Well, for my third year, I asked my supervisor, I'm like, listen, let me do OBGYN first because I just want to get it done and over with, because I hear it's a tough rotation, and I know I don't want to do it. Well, lo and behold, I didn't realize, but I really like operating. I like fixing things with my hands and being to fix a problem as fast as possible. And so I was like, oh man, I didn't think I was going to be a surgeon because I thought a lot of the surgeons were kind of mean, so I didn't think I was a mean guy. But I really love the operating room. And so then I was really torn. Then I did my surgery rotation, and I was really picking between, should I do general surgery or should I do OB or should I? And then at the very last part of my third year, I had a meeting with the OBGYN advisor. He was, we were just talking, we had a good time talking, then all of a sudden he's like, oh Chris, I gotta go to do a case, and he was telling me how this lady who he's taking out the uterus for, well, he delivered her babies, and then, saw her whole life pretty much, and now is still seeing her. And I was like, well, that's why I wanted to be a doctor. I wanted to be a doctor because it's nice to talk to people, nice to build relationships and help people out. And OBGYN is the only surgical field where, yeah, I fix your problem by surgery, but I don't kick you out. If you have like a gallbladder issue, the general surgeon will fix the gallbladder and say, hey, see you later. But with OBGYN, it's like, I take out your uterus, but no, you still come back, you still see me, and we still get to see each other for, until you go away. You know what I mean? So that's why I did OB.
That's awesome. What are some things you wish a professor told you before you started working as an official OBGYN?
Oh, that's a good one. I think I kind of already knew a lot of things, but like I wish my professor told me how challenging. OBGYN, most of the time it's really happy. Most of the time. Mm-hmm. But when something bad happens, it's really bad. And I wish my instructors told me that, how much of a mental toll that can take. So like the first time for example, I was a resident, and I was a second year resident. I was doing an ultrasound, and I was actually doing the ultrasound of a friend of mine's wife. And so, as a resident, you do rotations at all the different things too. And so I met this guy in the ICU because he was kind of my boss, and he really treated me well, and we got along just fine. And then I find out his wife is pregnant, and they're super excited. It's their first pregnancy. Well, I was working in labor and delivery, and one day they came in, and he was telling me how his wife just hasn't felt the baby move. And I was like, oh, yeah, it happens. Well, and so when I put the ultrasound, we didn't see the heartbeat. That's when I was like, holy moly, you know. And I think none of my professors really prepared me for that per se. I mean, it's gonna happen. It happens quite a bit, but so that was one thing that I was really shocked, like how I would have dealt with that. But the good thing is, you know, my friend kind of came back to me and was like, listen, I'm really happy you were the one who was there, and you like talked us through everything. And so that's when I knew. I was like, you know what, this is a good field, you know, just keep doing what I'm doing. So yeah.
Okay. What is your daily routine as an OBGYN?
It's so unpredictable. It really depends. Like right now, because I do have patients that could go into labor, so this is my typical day. I wake up at like 5:30 in the morning to check my phone to make sure no one's in labor. If no one's in labor, I get a couple more hours of sleep. And then I go to my office. I have clinic until, you know, the afternoon, and then I go home. But that's the dream situation. But sometimes it's like, oh, I have somebody in labor, so as soon as I, you know, check and I see somebody, I go straight to the hospital, and I'm there. And then sometimes I have to cancel my clinic. And you just never know. Sometimes I'll just get a phone call and be like, hey, so-and-so is in labor. And I'll be like, got it. All right, I'll see you in 15 minutes. You know, so very unpredictable. But I think that's part of the fun. You know, because if you can have the same thing over and over again, it gets boring.
Yeah.
You kind of just like, so that's what I like.
Okay. Do you have a favorite part of your day?
Besides going home, no. Honestly, you know, it really varies. You know, varies. I think every day there's always a patient that makes me just smile and it kind of just reinforces why I do things. And it doesn't matter what it is. There's always, I tend to see somebody every day, and I think that's probably my favorite parts. When I see, you know, when I realize that I'm doing something to really help somebody. And that can happen at any point, you know. Most of the days it happens quite a bit. Some days though it happens once. But that's all you need, you know.
Okay. What disease grosses you out the most?
Well, you know, I'm an OBGYN. There's quite a bit of things down there that are not pretty. Is this rated PG-13? Okay, I'll be PG-13. Let's just say, you know, some of the worst things are kind of just like, I don't want to go into specifics. There's some things that can grow down there that you really don't want growing. That's all I'll say.
Okay. Describe how your first examination went.
Oh, it was awful. Well, my first examination was on a dummy, and I don't know what I'm doing. I mean, could you just imagine as a medical student and like, so with my first real patient, it's a little bit better because we do all these like simulations and like training, but it's still uncomfortable. And you have to understand, as a male OBGYN, my job is to make sure that my patient feels comfortable with me, and that is probably the hardest thing. And so when I talk to my patients, I know within the first few minutes whether or not I have their trust. And so that's what I try to build on as soon as I talk to them. And I don't like to do an exam until I know my patients are comfortable. And I think that's the biggest trick to being a male OB is you gotta make them feel comfortable. And don't do, you know, it's how you present things. The more the patient understands why you're doing things, the easier things are.
Alright. As an OBGYN, what does your job entail?
A lot of things. One, as you guys know, we do a lot of, labor and delivery. So a lot of the pregnancy visits, then actually delivering the baby. That's the most common answer. But OBGYNs do a lot more. We are pretty much the women's go-to doctor with regards to their pelvic health. Biggest things that we do is cervical cancer screening, breast cancer screening. These are things that are, in other countries, it's really bad because they don't have access to these. But here, we've been fortunate that we can cut down rates on a lot of these things that can kill women. Birth control, family planning. A woman has the right to choose when they can't have a baby. And that's, I think, important for us that we can offer these services for women. So really, it's not just pregnancy. We see everything. Sometimes a lot of women, I'm the only doctor that they see, so it's also important for me to try to get them involved to seeing other doctors to help manage not just OBGYN problems, but like blood pressure, weight loss, those kinds of things.
Working here, has there ever been an event or an occurrence with a patient that you'll never forget?
Happens every day. No. Man. There's been quite a few incidents where I'm like, wow, that's interesting. For example, we get a lot of patients that just like pass out. And so it's like, wow, what's going on? Well, I think it's because, in pregnancy, you don't drink too much, and then, so we've had events where someone was getting their blood drawn for a lab, where before they even got anything, they just kind of pass out. And so everybody rushes, and it's a big scene, and, stuff like that. Or, there are good times where, we're doing an ultrasound, and we find out it's a boy, and the mom always wanted a boy, and they get tearful, and those are moments that happen quite a bit, and so those are good moments. I would say there's one particular time yet that I was like shocked.
Is there a certain disease that you're fascinated / interested in?
OBGYN is really fascinating. I think a disease called preeclampsia is really interesting. That's when pregnant ladies towards the end of their pregnancy get really, really elevated blood pressures that could lead to eclampsia, which is when the pregnant moms get seizures. And that was a really serious, well, it's still a serious disease now, but now that we're learning more and more about it, we're really starting to change it. And I think it's really exciting what they have in store for management options. So that's really interesting. Cervical cancer is really interesting to me because I've never, it's one of the first times where we realized that it's a virus that causes cancer. So the Zika virus, so that's also interesting. Yeah, so the whole field is really interesting.
Can you give us one fact about something in your profession that you find fascinating?
Everything, duh. I don't know. Wow, that's a tough one. Because there's so many things in OBGYN that I think is super fascinating, but I don't want to sound like that dork. Well, I'm just looking at some of the things on here. You know how people are always asking, well, can I get an ultrasound so we can tell if it's a boy or a girl? The baby's genitals don't really form until we get to like the 16-week mark. And then when we do that ultrasound, everybody thinks it's to find out if it's a boy or a girl, when in reality, that's like the least important thing that ultrasound is for. Okay, the 20-week anatomy scan is really, really important to look at all of the baby's organs and not the genitals. In fact, if we didn't even know if it's a boy or girl, we wouldn't care. What we care about is a healthy baby. So I always think it's fascinating when I explain that to people. They're like, oh, okay. Yeah, so that's something. I don't know if that's as interesting to you guys as it is to me, but it's interesting.
Have you delivered any babies? If so, how many?
Delivered quite a few. Probably, including my residency, a few hundreds at least.
Wow.
At least. Lost track.
You want to do one more?
Okay. Is there anything else that you would like to mention or add?
I got nothing. Whatever you guys need. One happy answer.
Yeah.
Thank you.
Cool.
you so
Very
much.
good. Yeah.
Thank you, Dr. Manicola and staff at the Virginia Complete Care for Women for the interviewing opportunity. Thank you for joining us for LaFon's Newscast, Channel 16. See you next time.